And in 2003, I actually got really sick. That's when my doctor made me take a choice of working or quitting working and living. And so in 2003, I had to quit my job, and I ended up in the hospital with a parasite in my blood and my stool, and I had double pneumonia. I had a temperature of 105, so they put me in a little bit of a coma, I guess, for a while, just to get everything down. And then that's really when I realized that my life has changed.
I can't just go out anywhere and date anybody, and that's for me. If I were going to date someone, they would have to be positive also. And again, we'd have to protect ourselves to keep from reinfecting one another.
It was kind of a death sentence. What I was told was I would have up to 2 years to live. And so it really changed my whole thought process and direction in life. I decided not to go back to school. So I didn't go back to school because I felt that, well, I have 2 years, why do I want to go back to school, you know?
If I were to have unprotected sex with somebody that was positive, we'd probably have different strains. If we had unprotected sex, there's the possibility of creating a supervirus, or whatever drugs my partner is resistant to, I will become resistant to also.
I have a hard time of going and trying to get services. I think that I'm an average person, that, you know, I can maintain myself, but you can't, you know, with the medications and just daily things that you have to pay for. Or now that I'm on a fixed income, I'm on Social Security now.
I think I was distrustful before the diagnosis, but since the diagnosis, obviously it was the ultimate betrayal.
My lifestyle has changed a lot. I used to have a good job that made a lot of money. Now I hardly make any, and so worrying about buying food and things like that, or going to food banks, I do that now, and I never thought that I would ever have to do something like that. So your pride, you know, you have to swallow your pride every now and then, and your dignity with this disease and the side effects of some of the medications. You never know what's going to happen.
After my diagnosis, I was still working, not in the medical field, but I went back to what I used to do, working in manufacturing. And I haven't worked since 2005. I am on disability.
That's when I started thinking about, you know, learning more and taking more active role in my care. And then that led me to volunteering for an agency, and then eventually working for that agency for about 9 years, and then doing my role as education and prevention and talking with other people that are living with it, whether they're newly diagnosed, have been long-term, and that's something that I've always enjoyed. And that's what led me to starting a new organization called Action Red, where it's really about peers being empowered and running programs and educating not only other peers, but the regular, you know, other community members, specifically trying to target the minority communities here in Las Vegas.